Yes.
The hip joint is a ball and socket joint and is the main weight bearing joint of the body. The hip joint can get wear and tear disease or arthritis or can get damaged, and the patient will then have difficulty in walking and have pain. The common causes of damage to the hip joint or arthritis in our country are avascular necrosis or loss of the blood supply to the ball or the head of the femur. This is usually due to alcohol intake or steroid abuse. The other causes are trauma to the joint, where the joint can get damaged, painful and arthritic. The third cause is rheumatoid or osteoarthritis, where the joint is damaged due to natural causes of arthritis like wear and tear, which is osteoarthritis, or rheumatoid arthritis, which can affect both the hips or multiple joints. When the patient has arthritis or pain in hip, the patient will have limping, difficulty in walking, the range of movement of the hip joint will decrease, and the patient will have pain in front of the thigh. Gradually, if the arthritis is neglected and not treated, then the patient will also develop shortening of that limb. The treatment for arthritis is severe arthritis is hip replacement, where the ball and the socket of the joint are changed. Currently in my practice, hip replacement patients go home after 2 days with single hip replacement and 3 or 4 days with bilateral or both hip replacements. I also perform both hip replacements at the same sitting in the same hospitalization if the patient's medical condition is good. Generally, the patients of hip replacement are young patients whose hips are damaged because of steroid or alcohol by a disease called avascular necrosis, as I explained earlier, or by rheumatoid or osteoarthritis, or by some injury or trauma. The hip replacement is a straightforward, safe operation in which the ball of the hip and the socket lining are changed. Currently, the best way of doing a hip replacement is through a small incision in which the ball and the lining of the hip are changed with uncemented prosthesis or prosthesis which get press fit into the socket and the thigh bone without any cement. In old patients, we may use cement to fix the thigh bone implant and the socket bone implant. We use the ceramic heads, which are the best quality heads implants which will last 25 to 30 years, and we also use 32 or 36 millimeter heads which give very good function to the patient. Normally the hip replacement patient is made to stand on the same day, walk on the next day, and the patient is allowed to go home on the third day. The patient is able to walk without any support for about a kilometer by 15 days and can regain full function at 1 month. Patient can drive and sit on low surface also after hip replacement, but patient cannot do Indian toilet type squatting after hip replacement. Hip replacement is a standard and safe surgical procedure and can give very rewarding results to the patient suffering from hip arthritis.